I have been in the field of orthopedic surgery for the last 20 years, and during this time I have seen large number of patients suffering from joint pain, especially knee joint. With advances in the medical science, we have added longevity in the life of human being, but associated with that is the problem of arthritis, which most of us are suffering from, and hence we see large number of patients suffering with knee arthritis. It is really unfortunate to see a person walking with painful limb and deformity. On the other hand, a person not walking at all, rather spending most of the time in the bed and asking for every small thing in the bed because getting up and walking is very painful. What is sad to know that these people are unaware of a simple procedure that can bring difference in their life. Total knee replacement can correct deformity, can take away pain, can bring freedom of movement and independence in their life. Knee replacement is a surgery in which we replace the cartilage of the knee. It's just like capping a tooth. There are a lot of myths about knee replacement surgery, and you won't be surprised many times when patient's relative ask me, "Doc, where is my mother's old knee?" And they are more surprised when we say, well, it's there with your mother. Only thing I have done is just the capping of knee, like capping of tooth. Knee replacement surgery is just taking away the worn cartilage and replacing with an artificial implant. This is the actual implant which is used in the patient on the femur bone. We make special cuts on the femur bone and we take away all the worn cartilage, and when the cut is perfect, we implant this on the femur bone of the patient. Similarly, this is the actual implant on the tibia bone, and after taking away all the worn cartilage and after having a specific cut, we implant this on the tibia bone, and this is the plastic which acts like an artificial cushion. So you can understand that this makes an artificial knee joint, an implant which is almost capping the femur bone, an implant which is capping the tibia bone, and a plastic which is acting like a cushion in the knee joint, giving a painless, stable, mobile knee. There are many reasons we have won the confidence of patient as far as knee replacement is concerned, and one of the main thing is care of pain, or you can say control of pain after the surgery. We are still the same for the last so many generations, but yet knee replacement surgery is less painful now than it used to be almost 10 to 15 years ago. One is the improvement in the anesthesia. Almost all patients undergoing knee replacement are given spinal or epidural anesthesia, meaning which that only the legs are made numb, not the rest part of the body. This helps us in taking care of pain after the surgery. We give injections during the surgery at specific locations which take care of pain after the surgery. Then there are special pumps after the surgery which patient control themselves and give shot of painkiller medicines to the patient as and when it is required by the patient. All this, besides routine oral and injectable medicines, takes care of pain very effectively after knee replacement surgery. You won't be surprised that most of the patients do have good range of motion on the day and the next day after the surgery. What I'm trying to tell you is, by using these modalities during the surgery and immediately after the surgery, we have been able to greatly reduce the pain suffered by patients. You won't be surprised that by the time patient goes back home on 5th day after surgery or 6th day after surgery, they start ambulating with walker in the corridors, they start getting up from the bed, sitting on chair, start going to the bathroom on their own, getting up from the pot on their own, and most of them do stair climbing. If the patient have confidence, then many of them even start doing cycling during these 5 days. I have patients who have started sitting cross-legged during these 5 days after the surgery. It's really wonderful when my patient comes to me after surgery and tell me, "Doc, I have got second life." And they are so happy about their freedom of mobility and freedom from pain. And it makes them happy, and I'm happier, even more happier for them. Total knee replacement has come a long way. Not only there has been a marked improvement in the implants, but unfortunately younger and younger patients are undergoing this surgery. Painless mobility is one thing, freedom of pain and mobility is another thing, but people want more. They want smaller incision, they want quicker and earlier recovery from the surgery, and they want near normal functions which were not possible with the previous generation of implants. Now after surgery, people can sit on the floor, they can sit cross-legged, they can do their religious activities on the floor, they can do yoga, they can exercise, they can do some light sports like badminton or tennis, early driving of car, name it, and people can do after knee replacement surgery. Most of the time people require a physiotherapy of month and a half after bilateral knee replacement, but if patients are active, they feel themselves a part of the program, you won't be surprised if people come without stick at 2 weeks after the surgery. After doing a large number of knee replacement surgeries, I feel it gives new life to the patient, it adds life to their ears, and it gives independence not only to the patient but to their families as well.